Hello, good evening. How am I supposed Hello, good evening, everyone. I don't know if you can hear me. Okay, so good evening. My name is Dr. Iwenekha Precious, and I'm going to be talking on a very interesting but important topic. As we all know, we've been hearing a lot of news, social media handles, all talking about cholera. We've been seeing cholera outbreaks flying around. There's cholera outbreak in Lagos, there's flood, there's everything. So what's cholera basically? What's happening? Why is there an outbreak? As we all know, Nigeria is a very densely populated area and we have a lot of water, riverine areas, flooding and the rest. So this is a factor that attributed to the outbreak of cholera. But before I start, I'm going to be talking about what cholera means, what cholera is all about, and I'll just stay with me. We're going to be doing this together. So, what is cholera generally? What is this cholera we're all talking about? So, cholera is a bacterial infection of the small intestine, and this bacteria is caused by a bacteria called Vibrio cholerae. And this bacteria, when it gets into the body, it causes severe diarrhea, you have dehydration, and a lot of loss of fluid of the body. It can be very, very fatal. We might say, oh, it's just diarrhea, it's just dehydration. No, it can be very, very severe once you've contacted this virus. So I'm going to be talking basically on the causes of cholera. What's even happening? Why are we having cholera? What is causing this cholera? So cholera most times can be transmitted via a route, or what we call this route a fecal oral route. That is from the feces to the mouth. So most times some people go to the toilets, they don't wash their hands, they just come out and start cooking. And then you just get drinking water from anywhere at all. We can just buy pure water from the streets. We don't know how they get the water, we don't know the source of the water, and we just drink. Most times this Vibrio cholera, this bacterial infection, mostly resides in water. They habitate in water most of the time. That's where they breed. So when the water is contaminated and we take it into the body, okay, we take it into the body, we would contact this cholera. Now, the two major things that can lead to cholera is food and water. Majorly water. Okay, next slide, please. Okay, when one has cholera, how are we going to know we have cholera? Okay, we've drank this water, we've eaten this food, we have we've gone to the toilet, we didn't wash our hands, probably we just ate like that. How do we know that we have gotten cholera? We would have severe dehydration. You become very thirsty. Unlike diarrhea, when we lose fluid, diarrhea, like when you purge, you can drink enough of water, you can take water, keep taking water, you can feel better. But when it comes to cholera, the case is totally different because this virus will make you continue to drink water. You continually keep taking water and you will not get better because why? This bacteria feeds on fluids, it feeds on water, it habitates on water. So as you keep taking in water, you keep feeling thirsty, you keep feeling weak, and you become more dehydrated, unlike the regular diarrhea that we know. Also, we would have shock and severe vomiting. Most time the diarrhea, okay, fine, maybe you're just purging. How do you even know that it is cholera? Most times your poo or your stool will be very watery, or it will have some kind of water, rice water coloration. You know, when you wash rice, you know the water that comes out, that's how your stool will be looking. Okay, so next slide, please. Okay, what do you do? How can you even prevent this cholera? What can we do? Okay, how? Why do we even have cholera? What is the problem? How did we get to this point? First of all, we know on the road when we are traveling on the road, we just see water, we buy. Some people selling kunu zobo, we just buy. We don't know where they get their source of water from. We don't know how clean it is. We don't know anything. And most times their sewage and drainage system are always bad. Most times people build houses and put the drainage system in the river, and then these people go to the river, they wash the bottles they used to sell all those things. They use the water to wash fruits too and many other things like that and sell it to us. So by default, we might not even know that these things are carriers of cholera. We get the cholera. The first thing we should do is make sure you wash your hands. Anytime you go to the toilet, you wash your hands. You wash your hands with soap frequently. Before you touch your food, you wash your hands. You you wash your children's bum, you wash their hands, because most times children are the most vulnerable to this cholera. You wash their hands, or if you're in a place where you don't have any source of water, you use any alcohol based sanitizer, or even you can use spirits to clean your hands at that time. So now avoid drinking water that you don't know the source. Avoid buying roadside water. Avoid buying water that are not sealed. Or most times you boil your water before drinking. If you're staying in a place where there's a lot of congestion, where there's a lot of sewage that is not well treated and all of that, make sure anytime you're drinking your water, or probably you're even fetching the water from the well, or you're fetching it from wherever you're getting it, make sure you boil the water before drinking. And also you're free to ask us any question, because there's going to be a giveaway after this section. So feel free to ask us any question. Okay, next slide please. Again, when we are buying food, instead of you to just go to Basira's kitchen and go and buy her food, something that she's just preparing fast, and maybe her child is there, her child just finished pooing, she just washed the child, she goes serve you the food, you eat because you just want quick food, or you want fast food, you just go, you just buy it and just eat. Avoid it. Avoid eating street food. Avoid eating food that you're not sure of how they prepare it. You cook your food very well. Avoid fish, raw food such as sushi, anything that comes from the water. If they are not well cooked, just like your crab, if they are not well cooked, avoid it. If you're not sure that okay, this place I'm eating this food, I don't know how they prepare it, you're not just sure, avoid it. Anytime you want to get fruit, especially our fruits, most times you don't even wash the fruit with clean water. Fruit like oranges, you just go fetch water from anywhere and just wash the fruit and sell it. And most times on the road, you see people, they will just carry the orange and bite to their teeth and drink it. That thing can be also have cholera bacteria on it, and then you don't know how, you just put it in your mouth. So anytime you're eating fruit, make sure you wash it. Either you wash it with salt water, or you peel the fruit before you eat, to avoid cholera. Okay, next slide please. Please, if you don't understand anything, feel free to ask us. Okay, now when one has cholera, okay, fine. Maybe we are done with all these things. We've taken note of the prevention and all, and in a way, we just get in contact with this bacteria, this cholera bacteria. What do we do? Sometimes it might not be our fault. We might go to places where they are they cook their food very well and still get cholera. In fact, when you get cholera, you won't even know you've gotten cholera till after 2 days, 2 to 5 days, before you would even start seeing the signs and symptoms of cholera. So you might even get it and you don't even know. So when you've had this cholera, what do you do? What's the first thing? What do you do? Please, you can also drop your questions on the app. You can drop your questions and just follow through. We have giveaway after this. Hope you're enjoying it. What do you do when you have cholera? First of all, we take oral rehydration solution. This oral rehydration solution can be gotten in any pharmacy, any chemist for as low as 100 naira. So you go take your oral rehydration therapy. Now, due to the fact that, as I said earlier, when you take in fluid, you still lose the fluid because of that's how cholera works. It feeds on your fluids. You have to take the amount of water, and that's it. You might not know, okay, fine, you take one bottle of this oral rehydration solution and you still don't feel okay, you can still repeat it. And even if you don't still feel okay, you can visit any hospital or talk to any medical professional, because after that, if you feel more weak, if you feel abdominal pains, because cholera can come with abdominal pains, severe weakness, you will not be able to move, you will not be able to go anywhere. In children, you see sometimes they might be rejecting this oral rehydration solution because it's not sweet. It's not sweet in their mouth. Then you'll be panicking. Okay, what do I do next? What do I do next? You have to visit the hospital. Rush immediately to the hospital because cholera can be very, very fatal. If you just stay and okay, fine, I'm giving this person, maybe the person will get better, and the person is not getting better, as the medical professional, will give you intravenous fluids, because we'll first test you to ascertain, okay, how much fluids have you lost, how much electrolytes have you lost, before we administer our intravenous fluids. Then in most cases, antibiotics are also given, most cases, and then zinc supplements, why? Because they replace the already lost electrolytes in the body. Okay, please, can we get the next slide? And if you still have any question, if you're confused, you can feel free to ask us, drop your questions on the comment section. The best part of it is that when you get cholera, it can be tackled immediately, it can be treated immediately, and some people have very strong immune system. So once they get cholera after taking the oral rehydration solution, they might feel better than other people. But there is a vaccine. This vaccine is called Vacacora. This vaccine is taken orally. So there's a vaccine to prevent cholera, and it can be given to all age group from 2 years to the oldest in the community. It's taken orally. The thing is that cholera can be very fatal. It can even cause seizure, kidney failure. And when one has kidney failure, it's a whole lot of process. It is not just, oh, they administer oral rehydration fluid. No, you have to go for kidney dialysis, and you know how expensive it is. So it's best that once you just feel these symptoms, you have serious diarrhea, you're purging, you're always feeling thirsty, it's best you go to the hospital on time, because if not tackled on time, it's very fatal. It might lead to death if not tackled on time. We've seen cases of people that have cholera and they just keep drying up and drying up and drying up. Why? Because the fluid in their body and the electrolytes helping them is gone. So you have to contact your doctor, you have to talk to the medical practitioner, you have to ask questions, rush to the clinic and get more questions. And then for people that are building houses, if you're building houses, make sure you connect your drainage, you build proper sewage and drainage system. Avoid sending your drainage system to the water, to the rivers, because people fetch water from there. Some people, when they're also traveling, you just see them, they go and pour in the water, and people are drinking it because, as I said, Nigeria is a very populated place where there's a lot of people are even staying on top of water, and that same water they drink it. So when one is building house, they should also put that in consideration. Okay, fine, let me build a proper drainage and sewage for this community to avoid cholera outbreak. Cholera has been there before time, but why it's an outbreak now, or why it's becoming more serious, is because of the whole flooding, the overcrowdedness, and everything. Thank you for listening. If you have any question, feel free to ask. I'm going to be bringing up my colleague here to come and talk more on cholera. Thank you.
Hey, hello guys. Hello guys. How are you doing? Thank you so much, Dr. Precious, for the good work so far. Please help us celebrate her, give her a hand. You know, she has done so well to really explain what cholera is all about. It's surprising that in the olden days, cholera used to be like a frequent outbreak. It's surprising that after so many years, we are almost having cholera twice a year in this country. Cholera epidemic since like 2 or 3 years back has been coming back like back to back twice a year. And this just goes to show how the government has actually failed, how everything, the infrastructure has failed, has dilapidated, and we don't have potable water supply for everybody. It's just a failure of the health system and every other thing, and also the environmental information about the environment and all that. It will surprise you that there are some people who still fetch water from the river. Even in Abuja, there are people who fetch water from the river. So it's not a surprising thing to see that we are now coming down with outbreaks that we never used to have before, and all that. And it has been here like back to back, almost twice a year. We're having frequent outbreaks of cholera, and this is not so good. It shows that many people don't have access to clean water. Our drainage systems are failing. People can always are sourcing water from very impure sources. They are not taking care of their health. They are not washing their hands, or poor hygienic practices. So many things. We all have to put our hands together to make sure that we don't keep having these outbreaks. Consistently. So so that's that. So I want you to just feel free and put down your questions so that we can take them one after the other. Put down your questions so that we can take them one after the other. While you're putting down your questions, just want to tell you how important it is, why we decided to choose this topic. Now, the reason why this topic is very important at this point in time is because I was in the hospital as at the last cholera outbreak in Abuja, and it was really very, very bad. It was very bad. This was, I think, last year, and all that. It was bad. It's like this thing has been like it always comes to me. Now, we had patients who came in very, very bad, back to back. We're having them, very, very bad. We had patients who looked like they've been squeezed, like all the water in their body have been squeezed. That human body is made up mostly of water. So if we lose our water from our feces, of course, the body will dry up. And not just that we are losing our water, we're also losing the most important electrolytes, especially potassium. The electrolyte potassium. And this potassium is very, very important for the heart function and from a lot of the organs function. This potassium is very, very important. We have had people who died of cardiac arrest as a result of cholera. As in, to show you how bad it is. We've had people who died of kidney failure as a result of cholera. We've had people who survived too, because they came in at the nick of time. We had people who passed out, who even died in their houses before they came to the hospital. The one thing about cholera is that the feces of cholera has a distinct smell. And after some time, you see that the person loses control of himself. He starts to poo without even knowing that the poo is coming out. You just have fecal incontinence. You start to poo without nobody knowing, and without you knowing that the poo will just be coming out. So that's it. So that's that. Now, for the question, somebody asked, what antibiotics would you take when you have cholera? My dear, we don't encourage anybody to take any antibiotics. The simple truth is that it's not about the antibiotics you take when you have cholera. It's not about the antibiotics you take. Now, before even your antibiotics will even start to work to kill this bacteria, because this bacteria is pretty much difficult to disattach from the body. And the thing is, it's not even the what is causing the diarrhea is not even the bacteria itself, but the toxin that the bacteria itself releases. That is what latches and causes mayhem in the gut. So it's not about taking antibiotics. We have a lot of antibiotics that is being used in treatment of cholera. But the most important thing you should know is that once you are having that diarrhea and it is rice water color, it is coming out, it is very watery, and you keep having that diarrhea, please rush to the hospital as soon as you can. If you can take oral rehydration solution, please take that oral rehydration as much as you can while you're preparing to go to the hospital, because if this diarrhea persists, of course, you can lose a lot of electrolytes and it can put you in dire circumstances. Our aim here is not to prescribe anything for you, so we are not going to tell you the name of the antibiotics. The best action you should take is to go to the hospital and get care. So that is it. Now, somebody is asking if cholera is gotten from handshakes. Yes, cholera can be gotten from handshake. How can it be gotten from handshake? Somebody goes to the toilet and the person has cholera, and the person cleans his bum bum and did not wash his or her hands, and the person comes and shakes you, and you take your hand, you don't wash your hand, you put it in your mouth or use it to eat eba. Of course, you're going to grab the bacteria. I don't know why we're all calling virus. You're going to grab the bacteria, and the bacteria will cause diarrhea for you. So it is very possible that you can get cholera from handshakes. When we were attending to patients, we were washing our hands like every minute, every second. Sure, there was a time that there was no soap in the hospital. We kept shouting, "There's a cholera outbreak. There shouldn't be a time that there shouldn't be no soap in the hospital." We almost revolted that there was no soap in the hospital to wash our hands, because we're washing our hands. So imagine coming in contact, going to toilet, and you don't know where the person has been. The person now shakes you. Of course, if you're not careful, you will carry the bacteria from there. So that's that. So those are the things. It's I don't know if there's any other question. So cholera can be very, very disastrous. It can be very, very aggressive. We've seen, like I told you, we've seen people passing out from kidney failure. We've seen people who came in unconscious because they've lost a lot of they've lost their body water, total body water. And if you don't replace it immediately, it will look as though the person can even pass out from there and just pass out from there. Now, I've had the one good thing about cholera is that cholera responds well to treatment. If the person comes to the hospital as early as possible, it responds well to treatment. That's the good thing about cholera. So it's not like all those other aggressive diarrhea that don't respond to treatment. If you come early before the complications set in, of course, the treatment is always swift. Once they give you fluid and replace your body fluid, of course, you see that you start responding to treatment. You start responding to treatment and all that, and all that. The fluid will help to remove the toxins, will help to push out the toxins, from the body, will help to push out the toxins from the body, the cholera toxins from the body, and then you feel much better than even the loading you with a lot of antibiotics, that kind of thing. So you must ensure that once you suspect that you have cholera, you're pooing and you're seeing rice water stool, rush to the hospital to get IV fluid as soon as possible, and within 1 day, 2 days, you are fine. So it responds. Is one diarrhea disease that responds well to treatment. You don't even need too much jagger. Once I remember when I was doing my youth service, I had a patient who it was as though I was a miracle worker. The patient came into the consulting room and he was unconscious. He was totally unconscious. His whole body was soaked with feces. Everywhere was smelling. Short, everybody ran out of the hospital, the small PHC, because all the patients ran away because of that patient. Maybe they brought in that patient. The air around just changed, So what we did was that we got a very good cannula. We set it and we said, pumping him fluid. He's somebody that came and as we gave him up to like 4 fluids before he regained consciousness and was asking where he was and all those things before we could transfer him to the general hospitals, to continue his treatment. So it, as in, the response is usually good if seen on time. We've also had a patient who was living alone, was having diarrhea, and she could not call anybody, she could not reach out to anybody. She collapsed in her house. Before anybody could get to her, by the time they brought her, she was already having kidney failure. So we had to do dialysis and all that to get her to bring her out of the complications, you know, and all that. So so there are some, cholera can be really, really disastrous. It can be really disastrous. It's a very, very severe form of diarrhea, you know, and it can easily spread. It can easily spread. So ensure that you have good now ensure that you have good hygienic practices. It's always very, very good that you have good hygienic practices. If you don't use to wash your hands, learn how to wash your hands. Teach your children how to wash their hands. Teach your children how to wash their hands. Let it be a culture. Be used to it. Learn to wash your hands. Now, yeah, it is not only drinking contaminated water that can cause cholera. Dr. Precious has already mentioned that, you know, but most of the time, the culprit is usually water. The culprit is usually water most of the time, but it is not only drinking contaminated water that causes cholera. Yes. So that's that. Now, somebody's asking that, why does cholera only occur in poor and dirty areas? Of course. Why would cholera not happen in dirty and poor areas? Number one, do they have access to good water supply? No. The poor people, most of them cannot afford to buy dispenser water and be drinking like the rich people, right? Many of them, they drink tap water that directly from the tap. Some of them even drink waterboard, that's if they even see the waterboard. And some of those waterboard pipes may have been broken a long time ago, and maybe one sewage pipe is passing through it, you know, and all that, you know. So the also dirty and poor areas, of course, for an area to be dirty, it shows that the people that are living there are not are ignorant of environmental sanitation. You understand? And if they are ignorant of environmental sanitation, what do you expect that we follow? They will not be able to dispose of their feces well, and they would easily share bacteria amongst themselves. They will not be able to teach their children good hygienic practices. So these things come with poverty. So you see, whenever there's cholera, and maybe the public health people try to, you know, catch, you know, where the cholera is coming from based on the addresses of the people that are coming, you see that most of those, you can trace them to maybe a particular, you may even be able to trace the patients to a particular region in the city, or to know where the cholera is coming in, you know, and all that. So it is, you have seen that the dirty and poor areas, of course, is a risk factor. Living in a dirty and poor area and an environment, a dirty area, is already a risk factor for cholera. You understand? Poverty is a risk factor for cholera, you know, because of affordability of clean drinking water. Now, boiling water alone is enough to prevent cholera. If you boil your water, boiling your water is enough to prevent cholera. So I think you can boil your water to prevent cholera. So for those who cannot afford to buy water dispenser or to buy bottled water, boiling water is another method. While you're boiling the water, you have to be sure that the thing that you're using to boil the water is clean. The bottle that you're pouring the water in is also clean. So that is that. Now, another question that came in is, okay, is there a vaccine for cholera? Yeah, Dr. Precious has already mentioned that there is a vaccine for cholera. Whether it's safe and with no side effects, we don't know, but we know that there is a vaccine for cholera, you know, and all that. So what else? Okay, so keep your questions coming in. We're here to answer all your questions about cholera and all that. Then before we move to the to the main house to take the last questions for the giveaway. We're going to be no, I don't know if chairman is online. Chairman, are you online? Are we taking the giveaway questions here in the chat room, or we are taking the questions in the main house? So I need you to give me a response. But I'm still waiting for questions from all of you. I'm waiting for questions for all of you. Now,
Okay.
why cholera is very prevalent in poor areas and dirty areas, because they are a risk factor. That doesn't mean that a rich man cannot have cholera. Of course, a rich man who goes to buy mama put outside, or who goes to who mistakenly picks up a juice, that is not well prepared, of course, or that is prepared with water that is potable. Now, sometimes it may not even be that the people who make these things that actually cause this cholera, or know that they're actually causing the cholera. Now, it can be. I've had a situation where our plumbing got so bad that feces was leaking into the tap water. It was so bad that we had to even stop using even our tap water for cooking. Totally, we had to just stop, until it was sorted out. So that is the thing. Your sewage systems have to be properly managed and well aligned and far away from your tap water. If you have any reason to have an uncompromised sewage system, you can actually install a water sterilizing system to your tap water in order to be drinking out of it. There are some portable water sterilization system right now. They are the type that you can attach to your tap, that sterilizes your water, to some extent, and all that. Filters your water, then you can boil your water. There's the type you can attach to your types, that can help filter your water, and then maybe you can boil it before you can drink it. So don't be too certain that your borehole is safe. Boreholes are even one major source because they dig into the ground. So if your sewage mistakenly leaks and pours into the ground, it can easily seep into the borehole system and introduce bacteria into your drinking water. You understand? So watch out for cholera. Whenever there's an outbreak, be very, very careful. Wash your hands. Use your hand sanitizer where possible. Don't drink any water at any source that you cannot defend. Now, like the Precious has said, it may not be the food you ate now. So some people, they'll think that, oh, hey, when you ask them, why are you purging now? What did you eat? They'll be like, hey, maybe it's the beans I ate yesterday night. So it may not even be that beans you ate yesterday night. She said 2 to 5 days. It may be what you ate 5 days ago. You understand? So you should be careful. Maybe what you ate 5 days ago that causes the diarrhea. Maybe what you ate 3 days ago that causes diarrhea. Maybe what you ate 2 days ago that causes diarrhea. Not what you ate immediately. So whenever you see yourself stooling without rice water stool, don't think back. Always think back at what may have caused it, so that it can help you to make better decisions next time. So I think with no other questions, I'm still waiting to hear from. Okay, yeah. Now I can see some questions. Now, said, can cholera be spread by air? No. Cholera is a fecal-oral disease. It is mostly water or foodborne. Not that. Now, the difference between cholera and dysentery. Now, the diarrhea of cholera is rice water. It's watery. It has a very, very bad smell. It is pale. The diarrhea is pale like rice water, and then the dysentery is different, because dysentery, you have blood mixed with your stool, so the stool will be a little bit bloody. And dysenteric diarrhea is usually mucoid, sort of mixed with blood. That's dysenteric diarrhea. But the diarrhea of cholera is not dysenteric. It has no blood at all in it. It's just water, fluid, just pouring out there and all. So that is just it. That is the difference between cholera and dysentery. Cholera cannot spread by air. It is waterborne or foodborne. So any other questions? Yeah, so I think that's
cholera be
all
spread
the questions.
by
I'm still waiting to hear from the chairman. Yeah, what did you
Someone
say?
is asking if cholera can be spread by air.
No, I've answered that. I don't know if they heard me. I've answered that. It is waterborne or foodborne. Yeah. Okay. So that's that. So I don't know. Is the chairman on board? Um. So I hope you all have learned one or two things about cholera. Please, take care of your loved ones. Take care of your family. Cholera is there, and it is scary that it is an outbreak almost every year. It shows that we are not doing enough. Look at what is happening in Lagos. It is terrible to say the least. Why at this time should half of Lagos be consumed with flood? Is it that they don't understand that Lagos is surrounded with water? You know, when those flooding occurs, what do you think happens? Of course, those water come from the rivers that have been polluted already with stool and feces and a lot of other things. And you know, we come in contact with it somehow, when we have no choice but to wade in those waters. So it is crazy, and it is crazy, and we're not surprised that we are having an outbreak of cholera in Lagos. But how, I don't know, in Abuja, we had a very disastrous cholera outbreak last year, is what, either last year or 2 years ago, is what we can't explain. I expected better from Abuja. At least we don't have as many floods as Lagos have, you know, and we don't have like too many river areas as much as Lagos have. So it shows that our whole system is broken down. Our water drainages are collapsing. Our sewage disposal system is getting bad and all that. So I think we need to do better. We need all hands to be on deck to make sure that we prevent these cholera outbreaks. Let it be a thing of the past. And everybody has to do something to make it work. So let's not just be depending on the medical people in the hospitals. We all have a role to play, because if you went to toilet, and if you went to a public toilet and used the toilet and you washed your hands, of course, you wouldn't have gotten the cholera. Or if you had been careful of the kind of fluids you take in, you will not have gotten cholera. So do better so that we can all live healthy and stay healthy. Thank you so much. So if the chairman is not on, I don't know, is the chairman on board? I'm still waiting for Mr. Chairman. Yeah, there's a vaccine for cholera, but I don't think the vaccine is available in the hospitals right now. It's not available in the hospitals right now. Yeah, there's a vaccine for cholera, but it's not available. It's not available, like very available in the hospitals right now. You know, from my experience, I know that I don't think I remember telling patients to go and get any vaccine because it was not available. You know, and all that. So for a safety, I can't tell you much about safety or side effects of the vaccine right now, but the vaccine is available. I can't say much about the safety or side effects of the vaccine, but the vaccine is available. Okay. Yeah, okay. So thank you so much for listening to us. Thank you so much, Dr. Precious. Thank you. We love you. Thank you so much for
Thank
um,
you.
yeah,
Thank you for
and
listening.
thank you so much, everyone, for attending this webinar. We hope to see you in the house, because we're going back to the house now. There's a giveaway that we're waiting for. There's a giveaway, so we're going to be answering questions about cholera and hypertension that I talked about the last time. So we're going back to the house now. So get ready, please. Get ready for my question. And whenever chairman is on board, he will see who won. So I don't know. Let's get ready for the question. So we should be joining the house. The house. Aha. Okay. Okay, good. So they said 4 questions. We're going to be asking 4 questions. 4 questions. And whosoever answers them correctly, the chairman will give you your gift. So take note, we are going to the house now. So stay put. Go back to the WhatsApp group right now. Thank you so much for attending. Bye.